around the corner and her whole body was distorted.
She hemorrhaged. I never saw so much blood.
We just couldn't be intimate together.
I had the worst stabbing sensation. It was just so excruciating.
Next, two medical mysteries that defied the experts. Heather and Todd Talarico could never have prepared themselves for what would happen to their only daughter when a seemingly ordinary childhood illness suddenly spirals out of control.
I was helpless. I felt like I was losing my daughter.
Then, after more than 70 doctors dismiss Jennifer Marton Bray's chronic and debilitating symptoms, she begins to wonder if she'll ever be able to live a normal life again.
I just felt deep down inside that there was something really wrong with me.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In January of 1995, New Jersey natives Todd and Heather Talarico brought their daughter Gaby home from the hospital. It wasn't an easy first few days for the new parents, but they did their best to learn the ropes.
I was young, I was 24, and I was overwhelmed. But to have a new baby with my husband, we were ecstatic and elated.
It was just the best feeling I could ever have, except for having my own children.
Gaby was the first grandchild, so there was a lot more pomp and circumstance.
Slowly but surely, the Talaricos begin adjusting to life as a family of three. It's a joyful time for them as they get to know their little girl. But when Gaby is 6 months old, they notice something unusual on her skin.
The rash would appear kind of blotchy. There was no real symmetry to it. So it was this mystery rash.
Of course, being a nervous mom, I took her to the pediatrician and inquired about it.
But as soon as the pediatrician sees the strange rash, he assures Heather that there is absolutely nothing to be alarmed about.
The pediatrician said, it's no big deal. It's probably eczema. It's common in young babies. So just don't worry about it.
He suggests that they try treating it with an over-the-counter ointment and even try changing their laundry detergent in case she has sensitive skin. But nothing they do seems to help.
But we really couldn't find any real diagnosis to what the problem was, and neither could the pediatricians. So there was a lot of just, let's see where it goes.
But then, in July of that year, the family moves into a new house. And suddenly, the rash disappears. The concerned parents breathe a huge sigh of relief.
The condo that we lived in New Jersey was an old condominium, had forced hot air. We had never cleaned the ducts. This house had baseboard heat. She must have been allergic to something in the house. And sure enough, the rash never reappeared.
But as they settle into their new home, Heather begins meeting other mothers, and she soon notices that Gaby seems to get sick more often than other infants her age.
My family would comment all the time, gee, Gaby has another sinus infection or ear infection.
And almost every time she comes down with something, her temperature seems to skyrocket to 103 degrees.
The doctor just said it's just normal childhood diseases, and it's just the course that children have to take to get their immune system built up. At that time, it was a good enough answer for me because I didn't know any better.
We just said she was a sick little kid. She has a tendency to catch things a little bit more than everybody else does.
Heather and Todd do their best to stay calm each time Gaby gets sick. And over the next year, she seems to be growing like any other toddler. She's into everything, and her teeth are coming in. But when Gaby turns 2, the Talaricos begin noticing something very peculiar about her new teeth.
I noticed there was white spotting, which they actually called decalcification. I worked for Colgate at the time and was very aware of dental development.
The pediatric dentist told us she had low enamel coverage on her teeth, probably because of the high fevers. And we said, okay, we understand that, and because she did have high fevers. So every 6 months, we had to get coatings on her teeth to make them stronger.
Over the next 4 years, Heather and Todd try to come to terms with the fact that Gaby's simply the little girl on the playground who's most likely to catch whatever is going around.
You know, outside of being sick a lot, she was a chatty little young lady. She was growing. You know, we thought, okay, you know, things are starting to look okay.
Then, on a hot summer day in 2001, 6-year-old Gaby tells her parents once again that she isn't feeling well.
And I said, you know, lay down on the couch and, you know, just relax.
I took her temperature and it was at 103. So I said, okay, go rest. I'll put the TV on and I'll be right back.
But nothing could have prepared the Talaricos for what they would find when they came back into the living room.
Her back was rigid, her eyes were rolled into the back of her head. Fear, could she breathe? I literally just grabbed her, I picked her up, and we raced out the back door.
When Heather and Todd Talarico witnessed their 6-year-old daughter experiencing a terrifying seizure, they immediately put her in the car and race her to the nearest hospital.
I was scared to death. They rushed her in right away and they started working on her.
They put her on a IV drip to try to get her out of the seizure.
She was running a high fever. They just monitored her as she came out of the fever.
While the Talaricos are waiting for someone to tell them what's going on, they're praying that the seizure hasn't caused any long-term damage to their little girl. Finally, after what feels like an eternity, the medical team returns with a diagnosis.
They came out and they said, you know, Mr. and Mrs. Talarico, your daughter probably had a febrile seizure.
A febrile seizure is a convulsion triggered by a sudden spike in temperature that often occurs when an infection spreads through the body.
They said most children have febrile seizures between the age of infancy to 6. You know, Gaby's 6, so it is kind of rare that she'd have her first seizure at this age, but not uncommon.
Doctors treat Gaby with fluids and medication to bring her fever down. And within a couple of hours, she seems to be returning to her normal self. The doctors assure Heather and Todd that in most cases, febrile seizures aren't nearly as dangerous as they look, and Gaby's dismissed from the hospital the next morning. Over the next year, she doesn't experience any seizures. In fact, she seems to be as healthy as her classmates and completes first grade with flying colors. But then, one afternoon, when Gaby is feeling a little under the weather, her body very unexpectedly shuts down on her. Once again, she begins convulsing uncontrollably. In a state of panic, the Talaricos again race their daughter to the hospital.
We were surprised because we were thinking that these seizures are going to go away because she's getting older.
They ran blood tests again. They gave her an IV drip.
They started also saying maybe we should rule out epilepsy.
Heather and Todd watch helplessly as the medical team performs a battery of tests to find out whether or not Gaby is indeed epileptic.
With all these monitors coming off her head, she looked like some creature from outer space.
As a mom, I need an answer what's going on with my daughter's health. I'm frustrated.
After an agonizing wait, the findings finally come in, leaving the Talaricos with more questions than answers.
All the tests come back negative. This neurologist actually said, well, there are people that have febrile seizures beyond the age of 6. There's a good chance that she could just have febrile seizures.
Completely traumatized by the 2 seizures, the worried parents begin compulsively monitoring Gaby's temperature. They're confident that if they can catch a fever early enough, they'll be able to prevent another seizure.
We bunkered down into the house, laid out all the meds.
My husband and I would take shifts to make sure. We would set our alarm clocks to get up in the middle of the night to check on her if her fever's spiking.
We were scared parents because we'd seen 2, and we never wanted to see, we didn't want to see any more.
Now their lives are completely centered around keeping a watchful eye on their only daughter's health. But then, one morning in February of 2006, when Gaby complains she's not feeling well again, her parents come face to face with their greatest fear.
I came around the corner, and there she was, having this seizure. And this one was really bad. She was frothing. Her whole body was distorted. It was horrible. You could just see it was so much more severe. I immediately dialed 911.
Todd called me. He was hysterical and said that Gaby has gone through the worst seizure ever. We've almost lost her.
Biggest issue I thought was I was losing my daughter. I thought she was gonna die.
In a state of panic, Todd and Heather Talarico have just called 911. Their only child, 11-year-old Gaby, is experiencing a seizure like they've never seen before.
In the past, she would just come out of the seizure. This one, she wasn't coming out of.
I was helpless. I didn't know what to do. I felt like I was losing my daughter.
When the ambulance finally arrives, the Talaricos watch helplessly as the medical experts take charge.
When they got her gurneyed and into the ambulance, they had to inject this drug into her to get her to come out of the seizure.
Sign count from 6112.
After a nerve-wracking 15-minute drive, the ambulance arrives at the hospital and rushes Gaby into the emergency room.
They're really moving fast, got doctors over. All of a sudden we hear she's got a high fever, and we're thinking, oh great, you know, this is another febrile seizure.
While Gaby's family does their best just to keep it together, the medical team focuses on finding out what could have triggered the horrifying seizure. They run test after test, looking for some clue.
You see your granddaughter laying there, and there's nothing I can do. It's just, I wouldn't wish it on anyone. It's a terrible, terrible feeling.
When blood test results come back, the doctors do seem to have discovered a critical lead, but it's not good news. Gaby has a shockingly low calcium level. Most people have a calcium level ranging between 8 and 11. Gaby is registering a 5. A level this low is a sure sign that something is very wrong. Calcium is not only essential for strong bones and teeth, it also plays a critical role in the functioning of the heart and muscles. In the worst cases, severely low calcium levels can cause the heart to stop beating altogether. Suddenly, the clock is ticking, and doctors immediately move Gaby into the intensive care unit.
All of a sudden, this calcium problem, which we had never heard about before, was called to the attention. So all of a sudden, everybody's coming in. And that's the first time we met Dr. Cerami.
Pediatric endocrinologist Dr. Barbara Cerami immediately performs a head-to-toe exam.
When I saw her, she wasn't actively seizing. She does have the facial twitching, and her hands were definitely stiffened and clawed.
These are all critical clues, and after carefully reviewing the tests performed earlier that day, Dr. Cerami has a strong suspicion as to what's wrong with Gaby.
With Gaby, because of her age and from the history that we had gathered, it is most likely that this will be hypoparathyroidism.
Hypoparathyroidism is a condition in which the parathyroid glands located in the neck aren't functioning properly. In a healthy individual, the glands release the parathyroid hormone, which regulates how much calcium the body can store. In Gaby's case, her calcium levels are extremely low because her parathyroid glands are failing to release enough of the essential hormone.
And we were like, excuse me? What is that? She said most likely she has a deficiency where her body is not absorbing and utilizing calcium.
Suddenly, seemingly unrelated symptoms begin making sense to the Talaricos as Dr. Sarami walks them through how hypoparathyroidism affects the body. Whenever Gaby's calcium levels became too low, her body would experience what's called a hypocalcemic seizure, a neuromuscular reaction to the lack of calcium. Even Gaby's dental problems can now be explained. The low levels of calcium also resulted in weak enamel on her teeth.
We thought she just had a febrile seizure. Now all of a sudden things are starting to click.
And saying, hey, okay, now we're getting a diagnosis, we understand.
Dr. Sarami immediately begins treating Gaby with a seemingly simple therapy, an IV of highly concentrated calcium. For the next 5 days, the Talaricos watch their little girl regain her strength. During this time, they also begin learning how to manage Gaby's calcium levels at home with medication.
And to me, it was, okay, I can live with this. And if we can prevent those seizures by her taking pills, I'm all for it.
But just when her parents think they have a solid diagnosis in hand, Dr. Sarami warns them that they're not out of the woods yet. There is a critical missing piece to the puzzle that she still has to find.
When we make a diagnosis of hypoparathyroidism at her age group, it is often unlikely to be an isolated condition. More often, there are other associated autoimmune problems. The challenge was to identify what was causing the hypoparathyroidism.
Before Gaby is released from the hospital, Dr. Sarami draws more blood to test for other potential autoimmune problems.
Gaby was doing well, so we're like, okay, she'll call us. I'm sure they're going to be negative. We found their diagnosis. We're happy with that.
Confident that Gaby has been through the worst of it, the Talaricos head home and wait for the lab results. Nothing could have prepared them for what the tests would reveal.
We found out that, yes, indeed, she doesn't only have hypoparathyroidism, but there are other autoimmune problems involved.
Now, all of a sudden, what we thought was a good situation moving in the right direction now all of a sudden was like, oh my God, we're back to square one again.
After suffering for more than 11 years from severe seizures, significant tooth decay, and frequent fevers, Gaby Talarico has just been diagnosed with hypoparathyroidism, a rare condition that prevents her body from storing calcium.
It was kind of good news because all of a sudden we could put a name to something that was causing this.
But just when they think Gaby is in the clear, pediatric endocrinologist Barbara Sarami discovers that Todd and Heather Talarico's only child also has an alarming autoimmune disorder that could wreak havoc on her already fragile body.
Autoimmune disorder is basically the body producing antibodies that see its own self as being its target. So essentially, your body is attacking itself.
And she says, well, we did confirm the hypoparathyroidism. However, the series of tests that we ran found an antibody in her adrenal gland.
She said her adrenal gland will eventually shut down.
The adrenal glands sit on top of the kidneys and are part of the endocrine system, which regulates the body's hormones. In Gaby's case, the antibody present in her adrenal glands is not attacking them yet, but could start at any moment.
An antibody attacking your adrenal gland is a very serious condition. Your adrenal gland makes hormones necessary for maintenance of blood sugar as well as maintenance of blood pressure.
Now that she has confirmation that Gaby's adrenal gland is definitely involved, Dr. Sarami believes she knows what has been at the root of all the little girl's problems from the day she was born. There is only one question that needs to be answered in order to prove her theory. Did Gaby ever experience a chronic rash?
Gaby had candidiasis as a child, which was the mysterious rash, which we were all trying to find out what it was, which made sense.
The combination of these three conditions, the hypoparathyroidism, the adrenal gland antibody, and the candidiasis, confirms that Gaby is suffering from an extremely rare genetic autoimmune disorder that only 500 people are diagnosed with each year.
I diagnosed Gaby with i.b.s type 1, or autoimmune polyglandular endocrinopathy type 1. i.b.s type 1 is a rare condition where basically there is failure of organs to function because of formation of antibodies attacking different organs.
Depending on how i.b.s type 1 manifests, it can ultimately lead to diabetes, celiac disorder, anemia, or hepatitis, among other diseases. This, on top of the adrenal and parathyroid gland failure, can make i.b.s type 1 a very complicated disease.
If it goes undiagnosed, it could be fatal, especially if the adrenal involvement is not diagnosed.
The Talaricos are fortunate to have caught Gaby's i.b.s type 1 in time, but they still face many unknowns. Because the endocrine system is so critical to all of the body's functions, there's no way to predict just what will happen down the road.
My fears for Gaby's health is the unknown, not knowing what can manifest.
Any other disorder, you usually know where it's going to go. This is one of those where we don't know.
But while there is no cure for i.b.s type 1, by monitoring the adrenal and parathyroid glands on a regular basis through blood tests and medication, Dr. Sarami is hopeful that they will be able to help regulate the hormones they produce.
Going forward, to maintain her health, she will have to be on hormone replacement for the specific deficiencies that she has, and she will also need to be monitored closely for development of other autoimmune problems.
Although the Talaricos feel lucky to finally know what's wrong with their only child, they can't help but wish the diagnosis had been different.
I can't say I'm grateful or relieved to know. Certainly would like it another way, but I know that we can monitor her and she can live a long life.
I feel so much healthier now. I feel like a normal kid, and I have to take pills all the time, but I'm kind of used to it now.
The biggest thing I could say to any parent that's going through the questions of the unknown is dig deeper. You need to be your child's champion. And that's what we try to do for Gab, is to be her champion.
Today, Gaby is an active social preteen set on becoming a scientist or possibly a chef in the future.
She can do whatever she wants, or she's gonna go to college, be whatever she wants to be, and she'll take care of herself.
Gaby has done very well. Since her diagnosis, her calcium levels had been maintained quite well.
Gaby, knock on wood, has not had another seizure since she was diagnosed.
Having a disease didn't stop me for doing basketball, soccer, swimming. Just because you have a disease doesn't mean you can't do anything. If you put your mind to it, you can do anything.
While Gaby Talarico's family spent the first 13 years of her life desperately trying to figure out what was causing her terrifying attacks, Jennifer Marton Bray's family could never have imagined the series of agonizing medical emergencies that would be brought on by a single bizarre symptom. In the summer of 1985, Jennifer Marton was leading a seemingly ordinary life in a small New Jersey town and gearing up for her first year in junior high.
I'd had a pretty happy childhood. I loved softball and I used to cheerlead.
She was a happy-go-lucky little thing. She had a lot of school friends.
As her friends start going through puberty that year, Jennifer anxiously waits for her body to begin transforming as well. But she has no idea how dramatically her life is about to change.
Everything was fine until puberty, when she got her period. That's when everything went haywire.
When I turned 13 is when I had my first period. In health class, they talk to you about how it's going to be, and when I got it, it was nothing like what they described in school.
She got her period, she hemorrhaged. I mean, I never saw so much blood. Oh my goodness.
In a state of panic, her mother, Virginia Marton, rushes Jennifer to the ER.
They gave her a sonogram of her stomach and her ovaries.
I was filling a supersized pad 1 an hour.
And they said there was nothing wrong. She was a healthy 13-year-old.
The doctor assures them that Jennifer's body just needs time to adjust and that her period will regulate itself as the months go on. But a year later, she's still suffering from extremely heavy bleeding and severe cramping every month.
When I did have my period, I'd wake up to blood-soaked sheets. The bleeding is so heavy, I would bleed through my clothing at school. If I went out, we would have to stop every hour on the hour so that I could find a restroom because it was as if I was hemorrhaging. So basically, almost 2 weeks out of the month, I couldn't do anything.
Then, shortly after starting high school, Jennifer's periods rise to a whole new level when she begins experiencing incapacitating cramps.
Jennifer would lay on the couch, moan and groan. Ma, it hurts, it hurts. I don't know what's going on. Help me, help me.
To make matters even worse, Jennifer is beginning to feel nauseated 24 hours a day, 7 days a week.
Everything in my stomach felt like it was coming up and sitting right in my throat. I basically would take a bottle of Pepto-Bismol with me everywhere I went.
I mean, there had to be something wrong. We were so frustrated. She was so miserable.
Feeling helpless, Jennifer's mother starts taking her to doctor after doctor, looking for any clue as to what might be causing the bizarre symptoms.
We went to many doctors in a period of 4 years.
But every expert assures Mrs. Marton that her daughter is a healthy, normal teenager and focuses only on treating the symptoms.
Basically, all the physicians that I did go to would give me pain medication. I tried everything. I tried over-the-counter medications, I tried holistic medications, and just nothing was working.
Eventually, the harsh reality sets in. Jennifer is simply going to have to live with the dreadful symptoms.
You know, I just thought, well, maybe this is just me and this is what I'm supposed to be going through. It's just a family thing.
I blame myself. You know, why did I put her on this earth? Why does she have to suffer the way she's suffering? It wasn't fair. It wasn't fair.
Ever since the day she got her first period in 7th grade, 18-year-old Jennifer Marton has been suffering from round-the-clock nausea. And every month during her period, she bleeds so heavily that she's going through a supersized pad every hour. Every doctor she's been to is completely baffled by the strange symptoms. Then, when Jennifer begins college, a terrifying new condition begins to take over her life.
The vertigo first started to be severe and on a daily basis my freshman year of college. I would close my eyes and the room would still be spinning.
Vertigo is the sensation that your surrounding environment is moving, causing dizziness and disorientation.
I still remember times where I couldn't even make it through the doorway because the doorway seemed to have moved on me. In college, I missed a lot of class. I would copy notes from people that were in the class, and basically I just studied from home.
Distraught that her health is keeping her from experiencing a normal college life, Jennifer begins visiting another round of doctors, hoping that this time one of them will be able to figure out what's going on.
We went to ENTs, we went to endocrinologists, we went to neurologists, neurosurgeons, primary cares, gynecologists, you name it, we went to it. Couldn't figure out what was wrong. They just put me on an anti-vertigo medication, but the vertigo medication did not help. The only thing I could do is just curl up in bed and just wish and pray that it would stop.
Then, suddenly, after 2 grueling years of constant dizziness, the vertigo disappears. While no doctor can give her an explanation, Jennifer welcomes the reprieve. She eventually learns to manage the daily nausea and horrible periods well enough, and in 1996, Jennifer finally graduates from college.
It did take me an extra year to graduate because of all the missed classes, but there was never a point where I said no, that I'm gonna quit. I just kept on going.
With her degree in hand, Jennifer is feeling optimistic about her future and decides to move to Florida, where her parents have retired. Despite her ongoing symptoms, things start taking a turn for the better in Jennifer's personal life. In December of 2002, she meets Marton Bray at a nearby zoo, and soon after, the two begin a long-distance courtship.
We lived 2 hours away from each other. We would see each other only on weekends. I basically would plan our weekends around the time that I did not have my period.
My first impression, of course, was that she was just very beautiful, but she was very thin. I wasn't sure if she had an eating disorder, but it was something that I figured that we could work through.
I told him basically everything from the get-go. I said to him that I was not a healthy person, did not know what was causing all these problems. I gave him the chance to either stay or leave. His reaction was he was in it for the long haul.
Just 10 months after meeting, Jennifer and Michael tie the knot. While the newlyweds are ecstatic to have found each other, it's clear that Jennifer's illness is having an impact on their relationship.
The physical relationship was difficult, and he felt bad about the situation because anytime we would be intimate, I would have severe incontinence the next day and severe i.b.s, and he just didn't want to put me through that.
If she was feeling sick, she would just go to the bathroom and she'd be in there for an hour or two. And then she'd come back to bed and just lay down. We just couldn't be intimate together.
I don't know how anyone could ever tolerate me with the way I was.
Despite the heartbreaking struggle with their physical relationship, Jennifer and Michael desperately want to start a family, so they begin searching for an alternative.
I did not think that I could ever have children. I just felt deep down inside that there was something really wrong with me. So we started the adoption process a few months after we got married.
We started to build out the nursery. We got all the furniture and painted, nice, pretty pictures, rainbows.
But as they're excitedly preparing to welcome a child into their lives, something suddenly goes very wrong.
I had the worst stabbing sensation I had ever had in the whole time that I've had my period. It was just so excruciating. I couldn't stand up, I couldn't do anything.
Terrified by the pain, Jennifer visits her gynecologist once again, hoping that this time he'll find some clue as to what's causing her so much distress.
The exam was so painful, more painful than I've ever experienced. He could not move the uterus or anything, and he stated that I had a frozen pelvis. He did an ultrasound and stated that he saw a mass on my left ovary and that he wasn't exactly sure what it was. I lost it because immediately I thought cancer.
Over the past 20 years, more than 70 doctors have examined Jennifer Bray, and not one of them has been able to identify what's causing her excessive monthly bleeding, debilitating cramps, and constant nausea. But now, one doctor has discovered a large mass on her left ovary. Jennifer is sure that she has cancer.
I was dealing with this for so long that I figured if it is cancer, it's probably everywhere.
She knew very well what the survival rates of ovarian cancer were.
Jennifer is determined to find out, for better or worse, what the mass is. So her gynecologist refers her to gynecological surgeon Dr. Stephen McCarris.
She was really a mystery at first. Not only did she have debilitating, painful periods, but she also, as a married patient, couldn't even have relationships with her husband.
But along with these symptoms, Dr. McCarris also has an ovarian mass to consider.
With ovarian masses, we always worry about ovarian cancer.
Dr. McCarris begins running an exhaustive round of tests, including a special CA-125 blood test that will help him determine how likely it is that the growth is malignant.
Her CA-125 was 525 international units. 525. Normal is 0 to 35.
Suddenly, Jennifer's family must come to grips with the very real possibility that she may have cancer.
I think that she had always felt that there was a possibility, but this was the first time that it had actually had concrete numbers behind it.
She's my only child. Do you know what that did to our family? It was rough, really, really rough.
We both wanted kids. We both felt that this was something that could derail the adoption process that we had started.
The first thing that came to mind was, oh my God, we're probably gonna have to stop this adoption and we won't have a family.
As Jennifer and her family struggle to come to terms with the likelihood of cancer, Dr. McCarris directs his attention to one thing: finding out exactly what's growing on Jennifer's ovary.
We needed a diagnosis at this point. We had an elevated CA-125 and an ovarian mass. The only way to rule cancer out is to get that tissue into the laboratory and have a pathologist give me a tissue diagnosis.
On October 5th, 2005, Jennifer is wheeled into surgery to have the mass removed and tested.
When I was in the waiting room, I paced up and down like a tiger in a cage.
I did feel that this was a turning point. You know, all the other doctors had given her, drugs or supplements or vitamins. This was a real intervention that I felt was really going to make everything better.
Back in the OR, Dr. McCarris carefully explores Jennifer's lower abdomen laparoscopically, using a tiny camera on the end of a thin guide wire. And what he sees is shocking.
Both ovaries had masses that had grown and expanded to fill her entire pelvic cavity. And the ovaries, which are normally the size of a golf ball, had grown into the sizes of baseballs. I diagnosed Jennifer Bray with stage 4 endometriosis of her entire pelvic organs.
Endometriosis occurs when the tissue that lines the uterus grows outside of it, most often on the ovaries and other pelvic structures. During a normal menstrual cycle, this tissue breaks down and leaves the body through the vagina. But with endometriosis, the lining of the uterus recedes back into the pelvis, attaches to other organs, and grows. This results in internal bleeding and inflammation, and can cause extraordinary pain, infertility, and bowel and urinary bladder problems.
Jennifer Bray is in my top 10 list of patients with this disease.
In fact, Jennifer's endometriosis has invaded her entire pelvic region, including her ovaries, uterus, and fallopian tubes. The extent of the growth is so severe, Dr. Macaris has no choice but to remove all of Jennifer's reproductive organs in order to prevent the endometriosis from attacking any other part of her body.
I think if Jennifer would have continued on the path she was taking, that she would have had major complications from this disease. Jennifer was very close to having rectal endometriosis. Rectal endometriosis then increases the morbidity associated with the disease.
After surgery, when Jennifer comes to, Dr. Macaris explains to her the difficult decision he had to make.
Being only 34 and going through a hysterectomy, I guess would be hard for most people. I took it like a trooper, and I just figured I don't have to worry about periods, I don't have to worry about anything anymore.
Finally, after more than 20 years of living with this mysterious illness, the bizarre symptoms that were controlling Jennifer's life for so long begin to make sense.
The symptoms associated with endometriosis classically are painful periods, pain with intercourse, and irregular menses.
Dr. Macaris explains that Jennifer's constant nausea was likely a result of the agony she was experiencing from the other symptoms.
Her presentation was pain. I'm nauseated, I can't eat, I'm losing weight, and I'm wasting away.
But while she presented many classic symptoms of the disease, the vertigo she experienced is a little trickier to understand.
The one unique fact about endometriosis, it can develop and affect any part of the human body. So I guess it's possible or conceivable that Jennifer had endometriosis of the inner ear. That's just a theory, but this disease is a very unbiased disease.
Finally securing a diagnosis after all these years is a watershed moment for Jennifer and her whole family. But they're not in the clear yet. She still needs to find out the results of the cancer pathology reports. After 3 days in the hospital, Jennifer returns home and waits for the call from Dr. Macaris.
And I'll never forget when I was able to tell her she didn't have any cancer. The mystery was solved. Jennifer now could go on with her life.
Over the next 2 months, Jennifer rapidly returns to normal, a feeling she hasn't experienced since she was a little girl. Shortly afterward, she finishes what she and Michael started right before their last trip to the hospital.
In November of 2006, I traveled to China to meet and pick up our new daughter, Miranda Karis Marton Bray.
Jennifer is thrilled to have her life back, but can't help but wonder why so many doctors dismissed her symptoms over and over again. Endometriosis is one of the most common gynecological diseases, affecting more than 5.5 million women in North America alone.
This disease is likened the great imitator, and the patient gets turfed from this doctor to that doctor to this test to that test. So the next thing you know, the doctor has lost sight of the problem. The knee-jerk fix is give her a prescription for pain medicine.
Today, Jennifer is a vibrant, healthy 35-year-old woman who is determined to put her past behind her and live for the future.
Jennifer has taught me that no matter how bad things get, if you work through the problems that you have, good things will happen for you in the end.
I think it's important to share your story because in my case, if I would have found someone years ago that had something similar to me, I could have been diagnosed earlier. Today, I feel like I do cartwheels. I'm just so happy, and I've never felt better.